Hi, my name is Greg DeRoche, and I'm President and CEO of the Cambridge Chamber of Commerce, and I'm here to provide training on the Ontario Chamber Network's COVID-19 Rapid Screening Initiative. The Chamber of Commerce program is to identify asymptomatic cases of COVID-19 only in the workplace. If we're going to stop the spread and keep our workplaces safe, we need to know exactly where it is. Do not use these kits to validate COVID in people who have symptoms. They are not designed for that. Those who have symptoms, even the slightest, must arrange for a PCR diagnostic test with their local public health unit immediately. Rapid antigen testing is for screening and does not replace all of the things you are doing now. Wearing a mask, physical distancing, washing hands, and verbal screening are all still required under public health regulations. This is not the silver bullet. Rapid screening is not a replacement for vaccination. These kits do not prevent infection, reduce symptoms, or make you safe. They only help to keep your workplace safe. These kits are not to be used to build a case to gather either. Please follow public health rules and make sure your employees do as well. We're so close. Let's not fall back again now that we have this new tool. The provincial and federal governments have made these available for small and medium-sized businesses for free. But you must report your screens, and we make it easy to do it on a simple online form. We cannot refill your order unless 75% of the kits you have already gotten are reported. So, if you screen an employee presumptive positive, they must leave the workplace immediately, self-isolate, and book a PCR test at an assessment center within 24 hours. These employees must not re-enter the workplace or any other public setting until they have a negative PCR test result from their local public health unit. Okay, this process for self-swabbing is extremely easy, and I'm going to show it to you very shortly. But government regulations say they must watch this video if you're going to send individual tests home for employees to screen before coming into the workplace. They must watch the video as well. Okay, yes, another new kit. We've had the Abbott Panbio Rapid Screening Kit. We've had the Veritor. And now we have the Rapid Response Antigen Testing Kit. These come in boxes of 5 kits. So there are 5 test kits inside each of these boxes. You come with a little baggie of swabs. It comes with a little baggie of test tubes and paraphernalia to go with that, as well as it comes with a little baggie of pre-filled, 5 individual pre-filled buffering agent tabs as well. So I'm going to take you through this. It's very similar to the other ones. There's a little bit of a difference to it. It also has a good instruction manual that comes inside of it as well, but they show 2 different ways to swab. I'm not going to do the deep swab up into my brain. That's one of the options that you can do. I do the shallow swab. It's about 1 inch in. But there is something that you have to do while you're doing that to make sure that you get all of the elements on the swab so that the kit can be performed and the test can be performed with accuracy. And these are extremely accurate. They're great tests, and you'll find them very convenient because they come in 5-packs. So if you do have an employee that travels, and they can certainly take a kit and make sure they test twice a week, 2 times a week. So let's get into this. First of all, you would get everything out ready to go. You would have your little holder for your vials out, the little cap for your vial, which gives you the dropper in the end, and of course your swabs, your buffering agent, and then your test pad as well. The first things first is you would fill up the vial. So you would take this little prepackaged buffering agent. You would just snap off the end of it. It's very easy to do. You just kind of twist it. I think we've all had things that we've used with this kind of an opening. Pour it into the vial, all of it. And then you're ready to swab. And you would want to take the swab out, or have your employee take the swab out. These are very flexible, and I find them a little bit odd, actually, when it goes up into your nose, because you can't feel it too much going around. So there is a way to make sure that you capture as much of the element inside your nose as you possibly get. So it goes in about the same distance, about 1 inch or so. But if you squeeze along the edge of your nose and you can just twist it around in there, make sure you get it up into the top of your nose, like I said, about an inch in. But if you press up against the side of your nose, you can feel and compress it so that you're actually getting a lot of the elements from your nose. Do the same thing in the other nostril as well. Make sure that you press against it, and yeah, it can make you sneeze a little bit too sometimes, but making sure that you get as much of the elements from your nose onto the swab as you possibly can, because that's what it's drawing from. So take your vial with your pre-filled buffering agent in it, and basically the same type of thing as the other ones. You're just going to swish it around in there for 10 or 12 times. It does say to press it up against the edges and go up and down a little bit, making sure you're getting as much off as you can. You can pull it up. This test tube is very, very pliable, so you can squeeze out the swab as well, and making sure you're getting as much in. Make sure you do this at least for 15 seconds or 20 seconds or so, making sure you're getting as much off the swab as you possibly can. Take your swab out, then take your little dropper end that goes in the vial itself. It is a little bit tight. Sometimes people have a little bit of a problem getting in, but press it all the way down, and now you're ready to put it onto the test pad. The test pad is quite similar to the rest of them. You'll notice that it does have on there 15 minutes. Let it take 15 minutes to give you the result. There's a place where you put the drops right in there, and then there's a place where you'll get your reading. So let's put in our 3 drops. And we'll sit back and wait for 15 minutes and see what my result was. Well, that was a quick 15 minutes. Here's my result. I am negative. As you can see, there's a 1 red line under the C. The red line under the C means that, and there's no other red lines, that means that I'm negative. If there was a red line under the C and 1 under the T, that means I am positive. I must leave the workplace and go for a PCR test right away. And we've had a case where these have been used just recently, where a positive case was resulted and then confirmed with a PCR. So these are very accurate. If there was only a red line under the T, that means it's inconclusive. Wait about 10 or 15 minutes and redo the test again. It might be the way that you did the test, might be some other elements that were there that the test just couldn't conclude positive or negative, but give it a try after about 15 minutes. Once you've confirmed that you have watched this, you'll be able to pick up your initial order of kits. Please use them wisely and only for your employees. You may not use them for friends, family. They are intended to keep the workplace safe. There are other opportunities of pharmacies where people can get screened if they want to. And one last reminder, they are only for asymptomatic employees who actually go into the workplace on a regular basis. They are not intended for employees who are working predominantly from home. Please order your refills a couple of days before you run out. This gives distribution centers the opportunity to ensure supply, to ensure capacity limits in the facility you're picking them up on are safe and will more effectively be able to serve you. Go to chambercheck.ca for updates, FAQs, and other information related to the screening process, including reporting your results. Please be patient with us. It gets extremely busy and at times hard to keep up. Following these simple rules is easy and enables us to keep helping you and your business stay safe, stay open, and keep others safe as well. Good luck and happy screening. Once again, thank you for stepping forward to keep your workplace a safe workplace.